Welcome to this explainer. Today, we're diving into a really complex, deeply personal, and honestly often overwhelming topic, and that is navigating the world of addiction treatment facilities. If you, or maybe someone you know, has ever looked into treatment, you already know it can feel like a total maze of medical jargon and conflicting advice. So to make sense of the whole shebang, we're using the treatment model and source material from iRelyRecovery as our guide today. Their approach actually provides a really clear, straightforward framework for understanding how the continuum of care is truly supposed to work.
Think about this quote for a second, because it highlights a massive, often unspoken systemic problem in the rehab industry. Too often, patients are just slotted into programs based purely on, well, open beds, rather than what they actually need clinically. It's this dangerous guesswork approach that just expands the care cycle, ultimately pushing someone into an outpatient setting way before they're actually ready for it.
Okay, let's dive into this. Today's roadmap covers 1. The recovery guesswork problem. 2. Assessing the actual need. 3. Safely managing the detox. 4. Residential care and therapy. And finally, 5. Long-term aftercare success.
Starting with Section 1, the recovery guesswork problem. Why the standard business model fails patients.
So why exactly does this happen? Well, it really comes down to treating for convenience versus treating for clinical need. When a facility bases care on their own convenience, like say just filling an empty slot, patients are almost like square pegs being forced into round holes. They get accelerated into outpatient care while they still desperately need residential support. Now, iRelyRecovery's model pushes back hard against this. They match the level of care directly to the patient's unique substance use severity, their mental health stability, and any co-occurring medical needs. It's all about precision, not some arbitrary cookie-cutter timeline.
Moving to Section 2, assessing the actual need. The science behind tailored treatment.
To totally eliminate that guesswork we just talked about, clinicians rely on an industry standard known as the ASAM criteria. That stands for the American Society of Addiction Medicine. And guys, this isn't just some basic questionnaire you fill out in a waiting room. It's a highly comprehensive, scientifically backed set of guidelines. Healthcare providers use it to evaluate exactly what a patient needs, making absolutely sure they get the precise intensity of care required for their specific situation. And this brilliantly illustrates how deep that assessment really goes. To build a customized plan, clinicians look at 6 distinct dimensions. First, withdrawal management needs. Second, any biomedical conditions. Third, emotional and behavioral complications. Fourth, the patient's readiness to change. Fifth, their potential for relapse. And sixth, the patient's actual recovery environment. By thoroughly evaluating all 6 of these dimensions, treatment providers can build a plan that literally leaves no stone unturned.
Now, a really fascinating and I'd argue absolutely crucial part of this assessment is targeting what's known as a dual diagnosis. This means looking way beyond just the substance abuse to identify co-occurring mental health conditions. Whether we're talking about anxiety, bipolar disorder, depression, or PTSD, you have to treat the whole person. Because think about it, if you only treat the addiction and ignore the underlying PTSD or depression, that foundation for recovery, it simply isn't going to hold.
Section 3. Safely managing the detox. Step 1 of the continuum of care. All right, so once that comprehensive assessment is done, the first physical step is almost always detox. The source material outlines a process of subacute, medically supervised detoxification. Now, if you're wondering what subacute means, it basically means this phase is designed to manage mild to moderate withdrawal symptoms. Patients get 24/7 care, periodic assessments, and medication management to make sure they're safe and comfortable. But importantly, they don't necessarily require the super intense, hospital-level medical monitoring of an ICU.
And as you might guess, strict, evidence-based medical protocols have to be tailored to the specific substance. Coming off alcohol affects your body completely differently than withdrawing from opioids or fentanyl or meth. So treatment teams are highly equipped to safely handle a really wide variety of substances, ensuring the patient is safely guided through that initial physiological shock of getting clean.
Let's move to Section 4, Residential Care and Therapy. Step 2, Building life skills and coping mechanisms.
Setting timeline expectations is incredibly important for families. It kind of gives everyone a roadmap. Detox typically lasts anywhere from 3 to 10 days, and that seamlessly transitions into residential care, where the average stay is about 30 days. Though actually, depending on the severity found in that ASAM assessment we discussed, the inpatient stay can extend up to a maximum of 90 days.
Now, a super common and entirely understandable question people have at this stage is,
what is the actual difference between residential treatment and intensive outpatient programs, or IOP? Well, it really comes down to supervision and environment. Residential treatment gives you 24-hour inpatient care with on-site medical supervision. IOP, on the other hand, offers a lot more flexibility. Patients live at home while attending structured sessions a few times a week. So residential is for those higher supervision needs or complex co-occurring disorders, while IOP acts as a really great step-down for folks who already have a stable support system at home.
Within that residential setting, which the source notes is a very focused 11-bed facility, patients aren't just sitting around in a room. They're actively engaging in comprehensive, evidence-based therapies. For instance, they use cognitive behavioral therapy to rewire destructive thought patterns. They also use somatic experiencing therapy, which is amazing because it actually helps release trauma that gets trapped physically in the body. The goal here is to hit both the substance abuse and those deeply rooted underlying traumas we mentioned earlier.
But hey, recovery doesn't happen in a vacuum, right? A major pillar here is integrating the family across all ASAM levels of care. Loved ones are woven into the healing process right from day one through family therapy, behavioral contracts, and dedicated support groups. Providers actively educate the family on substance use disorders so that they truly understand their specific role in supporting the recovery journey.
Which brings us to Section 5, Long-Term Aftercare Success. Step 3, Life Beyond Rehab. Leaving the highly structured 24/7 environment of residential care can honestly be pretty daunting. So to ensure a patient doesn't suddenly lose momentum, treatment providers coordinate really specific step-down planning. Step 1 is case management, to perfectly map out the transition. Step 2 requires sharing the patient's treatment plans and progress with their next-level providers. And Step 3 involves making direct referrals to community resources and ongoing behavioral health services. It is all about creating a completely seamless transition back to everyday life.
Because statistically, isolation is one of the absolute biggest triggers for relapse, maintaining connection is vital. The source details a really robust alumni program designed specifically to prevent that isolation. We're talking safe social media engagement, private online communities, monthly dinners and events, and ongoing peer support networks. These structured social activities reinforce all those recovery-focused lifestyle changes made during residential treatment, and they keep the individual anchored in a really supportive community.
So we've covered the entire continuum of care today, from that initial, incredibly complex assessment right through to detox, residential therapy, and finally, lifelong aftercare. But it all comes circling back to our initial problem and this one crucial question: does your recovery rely on precision or guesswork? Don't ever settle for the nearest open bed. Demand a care plan that's actually built on your unique clinical needs. Thanks so much for joining me on this explainer today. Take this knowledge and use it to demand better care.